Stop taking antibiotics over the counter.
Umeumwa na kichwa, umesikia ni kama umechungulia throat kwa kioo, umeona uko na tonsils ni ya white. Unafanya nini? Umeendea augmented.
You don't know whether you're treating a bacterial infection, a viral infection, a parasitic infection, or a fungal infection.
Umemeza 2-3 days. Hata niko sawa. Ama hasikii mgonjwa. Nani amekwambia umepona? You know, just because you're feeling good does not mean that the ugonjwa, the infection that you had imepotea. Until now, you're full-blown hit by an infection which is making sure that you don't get out of bed. That is when you go to the hospital, you're like, yeah, I'm at your mercy, test me now and give me medication or something like that.
So make sure that your antibiotic is prescribed.
A lot of, let me call it misuse, abuse, overuse, inappropriate use of different types of medication, be it painkillers, be it antibiotics, be it other types of medication. A lot of people also don't know, or at times we know, and unfortunately, it's bringing in the concept of now abuse as well as resistance. And especially when it comes to use of amoxicillin, some simple medications, amoxicillin, augmentin, azithromax. I think that's one of the other things that is given out a lot. And people like it because it's only used for 3 days. So you find you're not getting sick, you have a very severe infection, you go to hospital, unaambiwa dawa fulani haiwork na dawa fulani zina work. So what is happening? You're becoming resistant to medication. And from a research basis, you find we become resistant to medication. So research, what does it do? They start looking for higher medication to kill that organism or microorganism. And in all honesty, I think if we would be able to reduce the way we misuse some dawas, avoid going over the counter, one. Most of the times you have a cold, you have a flu, you have a headache, and you're just refilling medication, and you don't know the reason as to why you have that headache. That's also risky behavior because una assume tu ni kichwa inakuuma. Maybe uko na shida ya macho. Maybe you're not drinking enough water. Maybe you're not sleeping well. Maybe your blood pressure is misbehaving. Maybe, God forbid, there's something growing in your brain and it's causing pressure, so you're getting the headaches. And if you go over the counter, make sure you're assessed first. Because these days, actually, if you go to pharmacies and chemists, you'll find whoever is seated there can be able to figure out that's just a normal cold and flu. You just need acetrizine, or that is actually seems serious. Please go and get tested first, and then we give you this. Then the medication can be prescribed because they usually learn those things at school. So wale watu wanakanga kwa chemist, pharmacy, ama kwa hosi pale kwa wenye wanapeana dispense down. So getting assessed first usually helps. Be careful. As you said, there's a register for healthcare workers. Unaweza Google uangalie huyu ni psychologist, huyu ni obstetrician, huyu ni nini. Si ati ana claim kukua kitu fulani. Huyu ni daktari. Huyu ni, and most of the time we also usually have these days after we are being asked for our certificate. Like unapata we moved from the days of because as a doctor I have said. These days a patient will be like, okay, so what are your qualifications? And you tell them. Hata ataenda hiyo university yenye ulisoma kuconfirm kama kenye mnasema ni ukweli. So there's a lot of people are, let me call them woke, wamejua hizi vitu. So hata kama second opinion si to another specialist, utapata they are doing their due diligence in the background to actually check and see kama what you're saying is the truth. Umesomea hii. They'll enter your social media platforms. I have patients who ask me, hey, so what's your social media handle? I'm like, okay. What have they gone to do? Testimonials, reviews. What exactly are you talking about on your platforms, on your website? Like people go back end to do due diligence. One of the other reasons why AMR is our short form for antimicrobial resistance and majorly resistance to antibiotics. An antibiotic is a dawa that works on a bacterial infection. If it is antiviral, a viral infection. If it's antiparasitic, kama dawa ya minyoo, that works on parasites. It's antifungal, that works on fungal infections. So there are different types of dawas to treat different infections. So antibiotic resistance is what has been on the rise. And so we are doing a lot of impacting knowledge, sharing information to enable people know on how to do something. So